If you're, as a PTA specifically, if you know that your PTs are taking a course, ask them about it. Say, hey, how is that course? What would be those 2 things that were your biggest takeaways? Maybe they'll do an in-service at lunch. So small little things like that maybe don't get you the continuing education units, but you still get a lot of knowledge, could be a way to start chipping away at that iceberg too.
Hello, everyone, and welcome back to another episode of the PTA Plus Podcast. I'm Katie Sutton, your host. Today's guest is Sarah Owens. Sarah is a physical therapist assistant from Illinois. She currently sits on the Illinois State Chapter Board of Directors in the PTA Director role, but she also has some other unique things that she does, including she is the Program Director for Evidence in Motion's PTA Orthopedic certification. Now, that's a really cool program for PTAs who are really wanting to hone in their skills in orthopedics and to really kind of expand on that. However, she talks a lot about the different continuing education and specialty areas that Evidence in Motion has, many of which that PTAs can take and expand their knowledge and clinical skills. We also talk about the combination of the APTA's PTA Advanced Proficiency Pathway and how this ties into the Evidence in Motion's orthopedic certification for PTAs. So we go over a ton of information today. I'm excited for you to hear all of it. And as always, thank you for listening. Hello, everyone, and welcome back to another episode of the PTA Plus Podcast. I am Katie Sutton, your host. We have an amazing guest with us today, Sarah Owens. Sarah, welcome to the show.
Thank you.
Yes, you have some really cool things that you're going to talk to us about today. Specifically, you came on to the podcast to talk to us about Evidence in Motion's PTA certifications that they have. And so I'm really excited to talk to you about that. I'm hoping we can get some of the nuts and bolts and details for our audience to learn more about that. I've heard a lot about the program, all good things. So I can't wait to hear it from you because you're the director of this program. Is that correct?
That is correct.
Awesome. Great. Well, before we get into any of that information about Evidence in Motion, because I'm really excited to focus on that and really drill down into certification and what this looks like for PTAs. What does CEUs look like for PTs and PTAs right now? How do we find good, high quality education and whatnot? So we'll dive into all of those things. But first, what we always like to ask our guests on this show is what makes them a PTA Plus. And I think that you have a lot of things that you can fill in that blank with. So if you don't mind, can you give the audience a little bit of a description of who you are, what you do for work, and then we'll fill in those blanks with what makes you a PTA Plus.
Sounds great. So like she mentioned, my name is Sarah Owens. I'm a physical therapist assistant, and I've been practicing since 2010 here in Central Illinois. I'm currently a full-time clinician in an outpatient orthopedic practice for professional therapy services. I manage a clinic in Morton, Illinois. My little plug for Morton is if you like pumpkin, we are the pumpkin capital of the world. Morton cans, I can't remember the exact statistics. I think it's like 85% of the world's pumpkin. That's where I practice. I am also the program director for Evidence in Motion's PTA specialty certification in orthopedics, as well as I'm super involved in the current Illinois Physical Therapy Association PTA director in my last year in that elected term. And I've really enjoyed that. It's been great over the last few years.
That's wonderful. I did not know that about pumpkins. So this is a new bit of information that I'm learning from you. It's like breaking news. Didn't realize that it was like the pumpkin headquarters or anything, but so you have you're the director, PTA director role for your board in Illinois. Yes. So what does that look like? Is that a director position that you run in an election for in Illinois?
Yeah, so the IPTA has both district level or kind of local level positions that you can run on the ballot for and be elected, and then chapter or component specific. So the PTA director is a chapter specific role. The PTA director sits on the board of directors for the IPTA as well as the executive committee. And I've been in this role now. This is my fourth year and the final year that I can run in a row. So we are actually looking and getting ready for elections to start, and we'll have a new person joining depending on who gets elected.
That's exciting. I am also on Ohio's board, Ohio Physical Therapy Association's board, as the PTA council rep. And it's a really great experience. So I would highly encourage any PTAs who are interested in becoming involved in their state association. I can't say enough wonderful things about how well it's developed me as a professional, as a leader. It has brought a lot to my attention about fiscal responsibility for each association, the management of what happens as far as what we provide to members. And so it's very important. So I guess this is kind of a nice shout out or heads up to anybody who's thinking about running in Illinois
Mhm.
for this position. It's a big role, but it's an important role, I
A
think.
very important role. This is our voice. I'm lucky that Illinois is so supportive of PTAs and allows us to have this kind of voice at a board of director level position. So, I didn't know much going into the role, but I've learned so much in the last 4 years.
Isn't it great whenever you have a look on that inside piece, and then you can go out and tell everybody about all the amazing things that your state chapter is doing, and just kind of spread the good news. I'm always saying the same thing as well. Ohio is very supportive of PTAs, and there really isn't much that a PTA can't do in the state of Ohio. And to me, that's very exciting. 20 years ago when I graduated, you're like a newbie compared to me. But these opportunities didn't exist. So to me, it's exciting knowing that my students, when they graduate, are going to have all of these different opportunities at their fingertips. And they might not recognize that though. So, sometimes there's something to be said about having to like fight for that position a little bit. So
Mm-hmm.
I don't know that they're going to necessarily see that history of how PTAs finally got to the point where they are and where we now have a lot of opportunity and a lot of leadership opportunity. So I always tell my students, I'm like, you have more at your fingertips now than I ever did 20 years ago.
That is 100% true.
Take advantage of it.
Yes,
Yes.
ma'am.
Yeah. So, some fun facts about you. You are a Batman fanatic. Is that correct?
Yep.
So,
I
tell me more about that.
Well, so when I was little, obviously I grew up in the Batman the Animated Series phase, but my mom was a huge Batman fan, and we used to watch the Adam West Batmans, or as I called them, the funny Batmans. I had Batman figurines, I had Batman clothes, I have Batman masks. I've seen every Batman movie multiple times. Um, but it all kind of came to a head when at my wedding they started playing the Batman theme song, and my mom had hired this actor to come to my wedding, and so I had
Fun.
Batman at my wedding. It was a lot of fun. So that's just my
That is
that's my
fun.
hobby.
Yeah, yeah. I mean, I do remember, of course, I grew up, my teenage years was mostly in the 90s, and there was a lot of the Batman stuff like happening. And yeah, so it was cool. Yeah. I dig it. I dig
I
it.
love it. I think I saw Lego Batman 5 times in the theaters, so it's
Fun.
maybe more of an addiction than a hobby, but I enjoy it nonetheless.
Wonderful. Well, we are totally fine with it. So you're good. Yeah.
Love it.
Great. All right. Is there anything else that you want to add to your PTA Plus list?
Really, I'm a PTA, but I'm also a mom. I have 2 kids. My son is 7, and he's so fun. He thinks he wants to do what I do, but he only wants to massage people's shoulders and their backs and not old people who don't know how to drive.
Okay.
That was his kind of thing. My daughter's spunky. She's 5. She's really big into wrestling. We're a big wrestling family, high school
Mm.
wrestling, not WWE wrestling.
Yes.
But that's what takes up most of my time. If it's not physical therapy or Batman, it's the kids and the family.
Gotcha. Yeah, I have 2 wrestlers in my house as well. So I
Wonderful.
am very accustomed to the let's see, late October to late March
Uh,
season.
yep, and you hope that they do well. but that just makes your season so much longer.
I know, right? And they always peak at a different season. And
Hmm.
anybody who has a wrestler in the house, it's an experience. It's
Very.
Yeah. You said she's 5,
Yes.
so she's still kind of just like getting started on it.
Yeah, she's mean. She's going
Okay.
to be a fierce competitor. She's ready to take people down and show them
Yeah.
who's boss. So
Yeah. Well, women's wrestling is like one of the fastest growing sports right now, so she'll have a lot of room to grow. It was just sanctioned in Ohio, I think, 2 years ago. So now we
great.
have girl state, and yeah,
I
so it's
love it. Illinois,
exciting.
I think we've been sanctioned now, I want to say 4 years, three or I think it's been four. It's hard to keep track. But yeah, it's where my husband coaches, they used to have one of the biggest girls teams in the state, and now we're just seeing it just grow.
Explode. Yeah,
Mhm.
definitely. Well, that's an awesome connection that we did not know in advance. So I'll keep you updated on wrestling. You keep me updated on wrestling, and
Will do.
we'll have to keep track, right?
Sounds great.
Okay, great. Let's dive into some of the questions about what we are talking about today, some of the nuts and bolts. So, some things that you and I had kind of passed information back and forth between each other before we actually hit the record button was about the variation in education. So, in not just education, but the variation and changes in physical therapy practice, but continuing education as well. So, how do you see that impacting the profession and specifically PTAs?
Sure. So I don't think it's lost on anybody that if a patient comes to your clinic to receive physical therapy, if they go to another clinic in the same locality, they might receive pretty different treatment. And that's probably one of the hardest things about physical therapy is we don't have the same approach, and sometimes that's a good thing to do a new lens, but that also leads to issues with, how insurances choose to do reimbursement and where patients are going for their care and what beliefs do they have about the care they receive, what's important. Where I practiced long ago, we were this area was very passive based. You would come to a physical therapy clinic and get modalities and stretches and maybe some hands on, and that's it. And so these clinics that started moving in where they were more exercise based, it kind of shifted the public's thinking about PT in a way. And when we look at PTAs, we are in a supervised role, but it's pretty neat. We're perfectly positioned to have a different flavor than our PTs and maybe shake things up a little bit. So if we have a patient of a PT who does more passive things, that allows us to have a voice with that PT saying, hey, maybe we should try this. What do you think about this? And really just make sure that we're that advocate for our patients as they progress along in their care.
Yeah, that's interesting. But you say that PTs can have a different flavor than their PTs, right? I always tell my students that we're very much so chameleons as a PTA. I don't necessarily have to have the same theory or thought process as the PT that I work under, but I have to certainly understand where they're coming from. So, if we want that progression to happen with a patient, that I need to understand their foundation of where they're coming from with their philosophy and their theory, so that we can both work on that plan of care together. Now, that doesn't mean that we can't bring ideas, right?
Right.
That's where you're saying we can have our own flavor and say, hey, what about this? And we can bring things to the table, bring suggestions to the table. But I like that, the point that you're making. Something that I've really been paying attention to lately is followership. Have you heard of that before?
No.
So followership is like, so you have leadership. We
Okay.
all know about leadership. We hear about
Yes.
leadership all the time, right? But followers are the ones that do the work. Followers are the ones that carry out that plan. And so as a PTA, we're the cheerleaders of our leadership, right? So we're
Right.
the ones who have to push that idea forward, and we drive that idea forward. But that also means that we have to be the ones that bring good suggestions and solutions to the table. So that's kind of like a little bit on that theory of followership. And today's episode is not about followership, but I've been
It's a
thinking
very
about it a lot.
interesting concept, though. Yeah.
Yeah, I mean, your followers can be leaders at some point in time, and that role can shift and reverse. I mean, I think any of us who've been in the clinic, which I haven't been in the clinic for a while, but when I was, I might have been the one that was a seasoned PTA and there might have been a new fresh PT coming in, I might have been a leader in some circumstances to that fresh PT, even though, we have our licensure differences and things like that and scope of practice, of course, following all that. But when it comes to that plan of care, I got to be a cheerleader for it. I got to drive it forward. So I can bring my flavor, but I got to understand their philosophy.
Exactly. And I think that's what maybe sets some PTAs apart from others is that ability to shift. I have PTs and I know their go-to exercises. So that way, when I get that patient in front of me, I don't cause a disconnect.
Mhm.
Every PT has their own flavor too. And I have to be able to take a little bit of that to get their patients better. If I'm going to be supervised by, let's say, PTA, and then the next day I have a patient of PTBs, we have to be able to shift within that.
Yeah, absolutely. And I also think that that speaks to the PT PTA relationship, right? Um, we need to be speaking highly of each other between the PTs and the PTAs. And I think that this is, it's certainly important for us to talk highly of the PTs as well, especially in front of our patients. But I think that it's also, it should be, the PTs need to be cautious about how they present the PTA. So it doesn't appear that we are less than in the patient's eyes. And I'm not saying that. I've worked with wonderful PTs my entire life.
Yes.
I've never had anybody be like, oh, well, she's just a PTA. I've never had that happen. But the way that we present each other can really make an impression on that patient. So, if we're lifting each other up and we're speaking highly of our team, our patients are going to be so impressed and excited to work with us, even though we have an assistant in our title, even though there's that word is in our title of assistant,
Mhm.
they're not getting less.
Right. Right.
So, speaking of partnerships and teamwork, tell me a little bit about Therapeutic Alliance. This is kind of a new, I shouldn't say new, but in maybe newer word that we're hearing a lot in physical therapy right now. But what is that? What does that actually mean, and what does it look like? And how do PTAs play into this?
Yeah. So really, when we look at what the literature has showed, it's kind of that effective bond between a therapist and a patient. And things that influence the therapeutic alliance, some of them are very basic. The PT and the patient agree on how we're going to go about achieving their goals, and we agree on the goals. But PTAs are kind of interesting because sure, we can have that effective bond with the patient, but when we think about a therapeutic alliance and making sure patients feel wanted and also empowered in their care, PTAs have to have a good working relationship with the PT and the PTA. And so your point about making sure that we are supportive of that PT plan of care is so important. When we think about the initial evaluation, a patient and a therapist are going to spend so much time getting to know the patient and coming up with goals and that plan of care. And how are we going to make you be able to squat down to the floor? And if I, as a PTA, come into that first treatment and I'm not aware of their goals and I'm not aware of their history, or maybe I say something that contradicts what the PT said at the evaluation, that's going to affect outcomes. That's going to affect patient satisfaction. And it can turn a really good evaluation into a negative treatment.
Mm.
And so when we think about that therapeutic alliance, we have to understand that, yes, the patient's important, but that teamwork between the PT and the PTA has a really big effect on that patient as well.
Wonderful points. That's a really good tips, and I think it ties into what we just talked about as well with that PT PTA team. But being that supportive connection, we have to have that good flow of information, and that's going to build that trust with patients. I try to teach my students this all the time. Of course, I work in PTA education, but we have to get that buy-in before the patient's going to get better. And if they don't seem to see a connection between that PT PTA team, that could make the whole thing fall apart. They're
Right.
not going to want
Very
to.
quickly. Very quickly.
Yeah, definitely.
And patients are consumers. And I know there are some that don't really like that term, consumers of care, but more and more, I have patients call my clinic and ask questions. How long have you guys been practicing? Do you use PTAs and what does that look like? what equipment do you have? What specialties do you have? Where years ago, when I first started practicing, I think patients were more passive in that approach. My doctor told me to come to therapy.
Mm-hmm.
He told me
Mm-hmm.
to come to you. That's why I'm coming to you. But patients have a choice. And
Mm-hmm.
so having a good understanding of the therapeutic alliance and what you can do to influence it is only going to grow that care and allow those patients to have satisfactory outcomes.
Yeah, absolutely. I think that people are becoming more savvy. I mean, I know this even about myself. Like, I will research to no end before I go to a new provider or a new doctor
Sure.
or whatever. I'm like, okay, I'm going to drill down here and ask lots of questions. And that's not to be a pain for anybody, but it's a patient's right.
Yeah.
And for so long, I agree with you. I think that patients just didn't really ask or say anything, and they have the right to know all of those things. So that's important that we're considering that.
Healthcare costs so much. I mean, insurance premiums are just, they continue to climb. We have multiple patients with a $75 copay. They're going to want to make sure if they're going to have to pay that much, that they're going somewhere that they want to be and that they know they're going to get better.
Yes, good reminder. They're spending their precious dollars. So, what are we doing with those precious dollars when they walk through the door? Yeah. One of my friends always says that it's a privilege that we get the chance to treat patients. Shout out to Sean. So,
I love that quote.
yeah,
Very,
he
very
always
good.
says it's a privilege to treat our patients. So, we can't forget that. So, yes. Now about some research, because I find the things that you're talking about to be very interesting. Therapeutic Alliance has been there's been more information coming out, more research about Therapeutic Alliance, what this looks like, and how we can all practice that. So, speaking of research, what are some ways that you find are easy to kind of keep yourself like up to date in the day to day and keep yourself reflecting on your skills? Because not everybody has the chance or the opportunity or the funds at the time to like go and do a lot of things, but like
Mhm.
how can we just get fresh information?
Yeah, the power of social media. Who you follow on social media is going to greatly influence what type of information you're receiving. And we have our influencers and we have those who maybe are in research that also have a social media account. So things like X or LinkedIn, and maybe not so much Instagram, but those two, X and LinkedIn, I'll have somebody post an article like, hey, did you know that why patients don't come back from an evaluation? We've looked at that, and these are kind of the reasons why.
Mm-hmm.
And one of those reasons is they don't connect with the therapist. So for quick things or quick reads, I do that. Being involved in your professional organization or a section. I know at least in Illinois, we have multiple monthly newsletters, and it's more happenings in the state, but I'm an orthopedic section member too, so I get little news blasts about new articles. Some of them are behind a paywall, so maybe you can't access, but you can at least have the abstract. And then a lot of different websites host blogs, podcasts, just like this podcast too. Those little clinical pearls. I know Evidence in Motion does a lot with that as well. They have a newsletter that they blast out and it'll have a clinical pearl or a technique. So searching those out and subscribing to those newsletters is helpful too.
Yeah, definitely. Speaking of evidence in motion, let's talk a little bit deeper about this. This is really cool. So you are the director for their program, which is the certification in PTA, the PTA
Yep.
certification in
Specialty
orthopedics.
certification in orthopedics. It's a
Okay.
mouthful, but yes,
Yeah.
yes.
Yeah.
I
So
actually
tell
started
us.
with them as a TA, and
Okay.
then over the years have grown into that program director role.
Okay. Yeah. So let's drill down with this. Like what is it? What does it look like? How do people get involved in this and get into it? Tell us the whole
Sure.
thing.
So, Evidence in Motion has always kind of been a leader in evidence based practice and, the newest research. And they have a lot out there for PTs. But PTAs were kind of the only accepted team member of in physical therapy. PTs supervise PTAs. And so they identified that there was a need for those PTs who went through residency or any kind of specialist certification. They were trying to delegate or supervise assistants that maybe didn't have a similar foundation of knowledge. And that's kind of where the PTA certification was born. A PT who goes through their OCS, they're going to want to work with a PTA who has the same foundational knowledge. And again, it's from a different lens where a PTA is more treatment. But that's how that got started. And so over the course of the last few years, we've added some things to it. But as it currently stands, it's a 5 to 7 month program. It is mostly online. We do have a chance that you can attend a two-day in-person lab, or for those people who travel might be kind of hard. Maybe you're, young family, or it's just not in the budget. We also take that 2-day lab and turn it into a 4-week virtual lab. One of the good things, I guess, that came out of COVID was our ability to do things virtually a little easier. But within this 5 to 7 month program, we're going to go into a lot of how do we look at research, different topics like specific to lower quarter. What are the current researches? What do the CPGs show? What are the diagnoses, and how do we best treat those conditions? So remember, evidence-based practice isn't just what you read. It's your clinical experience, but it's also what the patient believes as well. So it's teaching PTAs how to blend all three of those to get our patients better. We include a pain science course because the best way to treat chronic pain is to appropriately manage acute pain. And so we have to make sure that our words that we use with clients are going to facilitate those outcomes, and we're not reinforcing that patients are broken or something's damaged. And so as you continue to progress through the program, we have case studies, there's self-paced courses and faculty-led courses. There's a lot of communication between other students and faculty. There isn't a specific mentor piece, but we encourage you to practice. And a lot of our assignments talk about going to your PTs and going to your patients and trying these things. How did that work? What can we do to improve it? Maybe a PTA in Texas tries a technique that a PTA in New York never considered. And so now they have a chance to talk and bring back new flavors to their clinic. No, you're good. At the end of the certification, we just have a comprehensive exam. I think our most common question is, what letters do we get after our name? And so we tend to follow APTA recommendation on abbreviations. So going through the program doesn't get you letters, but you get the designation of specialty certification in orthopedics. But again, it's a mouthful.
Yeah. Beyond the letter, the end of our name, our title, we can go far beyond that. I think that those of us in this space understand that pretty well. Might not get any. There's a lot of things that I've done to improve my skills that I never got a pay raise with, or letters behind my name, but I did it anyways because
For sure. And as we go through things, you're not going to have every answer for every patient. And there's something to be said when you admit that you don't know something, but you tell them, I know a way that I'm going to find out. I'm in this program, I'm taking this class that's specific. We're talking about your condition this week. How exciting is that now these patients know that we're invested in them and we're doing the things outside of those work hours to continue to grow our skills to serve them better.
Went through or are going through the APTA advanced proficiency pathways? Went through it. Okay.
I went through it, and so I got that designation last year.
You teach in one and you've taken the other. What are like the things that are maybe similar and different, and what are reasons why?
Sure. So the APTA Advanced Proficiency Pathways is kind of a portfolio that they give to you of different skill sets that they've identified to be important for a particular practice area. So mine was in orthopedics, but they have geriatrics and they have acute care, cardiovascular. But APTA is going to give you a skill list that you would identify a mentor, and you work through different skills. And that mentor ensures that you demonstrate not only competency, but good clinical decision making, where they would feel that you would be a mentor to a PTA. The APP also requires 60 continuing education hours specific to your practice area, as well as a certain number of work hours. So APTAs is kind of an umbrella that encompasses multiple different parts. So your job is going to provide the work hours. Maybe your job is going to provide the mentor, the supervisor, but the continuing education, they really don't have a specific recommendation on that. So that's where evidence in motion fits in, and where my program fits in is, if you're going to go for that designation of advanced proficiency in orthopedics, this program is going to contain all of those CEs specific to your practice area with the most relevant research, and you don't have to go searching for things. APP is the highest designation a PTA can get. Now, like you said, it might not come with a pay raise, but the skills and just the knowledge that I learned helped me treat my patient better. And that's what solidified
Yeah, that's
it
interesting
for me.
that the evidence in motion kind of really plays nicely with that, and just can kind of help somebody meld into the advanced proficiency pathway. And I always like to tell people that we cannot become board certified, but that the apps are close. That's as close as we can get to it. And I like that both evidence in motion and the
Yes.
app have a comprehensive exam. I think that the app does it. Okay.
It would be like a comprehensive checklist. So what I did when I went through it, and this is good, it doesn't matter what pathway PTAs choose. It doesn't have to be in orthopedics, is I looked at this list and I thought, my goodness, there's a lot. And I identified things that I felt I was pretty strong with. Maybe those things that I could use a little fine tuning, but then I identified the areas of practice that I really needed a jump start. And that's what guided me towards the continuing education I received. And my mentor throughout the whole process, we worked through, yes, I agree, you're already done with that area. Here's where I need you to get better. So with the APP, it's going to be more discussion based with your physical therapist, compared to the EIM PTA specialty certification, where it's going to be more of
Gotcha.
a
Yeah, that
specific
makes sense.
exam.
This can seem very overwhelming. So, yeah, for somebody who's maybe
It
pretty
can.
new in the profession, is just kind of like figuring all this stuff out, and we're throwing out all these acronyms and names today, and big stuff. What would you recommend that they start with, just in general? Like, if they feel overwhelmed, where's a good place to start with the type of education that they seek out? Like, how would you recommend somebody look for education? How do they know it's a good fit for them?
Yeah. When I first started practicing, I'm really into feet and ankles. That's my jam. If I could treat all feet and ankles, I'd be fine. And so I took a lot of coursework on that. And while I was happy and excelling with that type of diagnosis, if I would get patients that had something I didn't like a Parkinson's diagnosis, it was hard for me. I just didn't have a good knowledge base. And the one diagnosis that I loathed seeing on my schedule was back pain. Well, how common is back pain? And the reason I didn't really care to treat it is I wasn't really good at it. So I bit the bullet and I decided to start taking specific classes on treating back pain. And eventually, after a few years, I dove into a pain science course that turned into a certification. And now back pain is one of my favorite things. So sometimes we have to strengthen those weaknesses. And so don't be afraid to look for, even if it's just a small course, maybe it's an in-service at your place of employment, or a quick 2-hour course that one of your coworkers teaches. Start to strengthen those weaknesses first. You don't have to commit to a huge program. And the beauty of, at least with evidence in motion, in my experience, is if you aren't quite sure what you want to do, there's tons of courses PTAs can take, whether it's sports specific, if it's pelvic health, if it's hand, if it's pain science, lifestyle med, you could take a single course and then decide where to go. So our virtual lab and our weekend lab, you can actually take those as standalone courses. You don't have to commit to a huge program. Then you can see if you like it. And then if you like it and you want, you could
That's a
go
very
on to
interesting
bigger and
perspective.
better
So
things.
I hope everybody was listening very well. That's a good way to like kind of break in without maybe necessarily having to commit to the whole thing.
Yeah. And just talk with people too. If you're, as a PTA specifically, if you know that your PTs are taking a course, ask them about it. Say, hey, how was that course? What would be those two things that were your biggest takeaways? Maybe they'll do an in-service at lunch. So small little things like that maybe don't get you the continuing education units, but you still get a lot of knowledge, could be a way to start
Great
chipping
advice.
away at that iceberg
Speaking of
too.
physical therapists, so if there's any physical therapists that are listening today, what would you say
I
is
know
a good way for them to
PTAs, we might not get a ton of foundational knowledge on going to the literature. So looking at literature, I was terrible at reading a research paper. I didn't get a lot of it in PTA school, and it was a struggle for me, but just continuously visiting things and reading it is a good way, and often a free
I
way
love
to
it.
get
Good
knowledge as
stuff.
well.
Speaking of PTs,
Yes.
so what if there's any PTs that are listening today, what would you say to them as far as like encouraging and gently pushing their PTA colleagues towards specialty certifications and specialty trainings in continuing education?
Yeah. For PTs, just remember your PTA is an extension of you. And so we want to make sure, as a PTA, speaking for PTAs, if I am not doing something the way my PT wants me to do, or I'm lacking in a specific skill set that my PT needs me to have, I would want my PT to kind of pull me along and encourage me to take specific courses. Maybe you're attending a webinar and you know that PTA is going to see a patient that might benefit from the information. Invite them along. Some of us aren't going to be those seekers of information. Maybe we're overwhelmed or we're nervous. So having that person to pull us along, encourage us, mentor us, and show us is good. If you're going through a residency program, see what's out there for those PTAs and encourage them to do the same thing, because they are an extension of you, and that's only going to make
Now,
your
on the
patients
flip
better.
side of that, how would you encourage a PTA who's struggling to find their voice and who maybe wants to do more, but is afraid to speak up for themselves or ask for specific continuing education? Like, could you give any advice to somebody on that?
Sure. From my experience, I knew what I wanted, and I had to find a way to present it, to my superiors, maybe not just my
Mhm.
PT, but we're talking, the big bosses. And I just mentioned, hey, this is what I'm noticing when I get a patient and they're with me. I don't feel that I'm giving them the best care that I could. If you would send me to this class, I would be able to do X, Y, and Z, because a lot of times business owners care about their return of investment too. So if you take a course, how is that going to benefit your company? Well, maybe I'll take a course and I'll teach an in-service to my staff, or I'll teach an education piece to it. By investing in me and sending me through the pain science certification, that opened up more referral sources for the company. So finding out how the certification or the continuing ed is going to benefit who pays for it can be very helpful too. But don't be afraid to have those hard conversations. I just had a fantastic PTA student, and she's graduating tomorrow, and we were talking about different items that occur in a PT session. Don't be afraid to be the squeaky wheel. If you have, and again, I have some fantastic therapists, but I have had some experience of ones that maybe just
Mhm.
weren't to the top of their game. And we take those PTs along with us, say, hey, can you provide me this? in our certification, our PTAs are learning about the special tests and what evaluations should look like. And if there is a missing component, those PTAs are going to learn the skills to take that back to the PT
That's
and
great.
offer a
That's a really
suggestion.
that we don't always think of, and I always encourage my students to hang out in PT evaluations, even if their clinical instructor is a PTA. I'll say, hey, get them in with the PT, let them watch a
Mhm.
few evaluations, have them ask questions, because understanding that piece is only going to help us as a PTA treating that patient in the future. So if you ever get the chance and you're listening and you're a CI, make sure that the student gets the opportunity to watch those evaluations as well. Us knowing that and breaking it down only helps us. It helps us treat that patient.
Yeah, and if you're a PTA in the clinic, think about how the new evaluation process works. So obviously, I'm an outpatient. I'm in the clinic with my PTs when they do evaluations. That PT should introduce you maybe the same day. That's something we've implemented. If my PT sees an evaluation and they go up to schedule, they'll say, Susie, by the way, this is Sarah. She's a PTA. She has XYZ skill set. You're going to see her next visit and you're going to love her. She has a good skill set. So that can kind of strengthen that bond and make that
I
patient
think
feel a
that
little
the
bit more
theme
comfortable
that I've
too.
been this whole recording that we've done so far, our whole conversation, is the words that we use. Right? There's so much power in the words that we use, the way that we speak to each other in a PT/PTA team, the way that we present ourselves in front of our patient, the way that we talk to our patients about what's happening with them. Um, the words that we use can have an impact. It's powerful.
Yes, they can.
Yeah.
It is very
So,
powerful.
any opportunities for PTAs to take different trainings, educational, continuing eds through evidence and motion as well? Or is it just that one specific PTA?
No, so there's actually, and if anybody is interested, they can always reach out to me. You can find my information online. Um, there is the PTA specialty certification in orthopedic. So obviously PTs can't take that, but a PTA can take pretty much any class under the pain science umbrella. So I have my therapeutic pain specialist certification through EIM, and that's how I became involved with the organization. PTAs, there's sports certifications they can take. I don't work in an area that has a lot of athletes, but I know up near
Mm-hmm.
Chicago, that is huge. And so PTAs can take that. We have pelvic health. And while your state practice act might limit what a PTA can do in that realm, we have that education. So there's a lot of standalone classes PTAs can take, but there's a lot of certifications too.
Mm.
Lifestyle medicine is huge, up and coming, empowering your patient just to live a healthier lifestyle. A lot of morbidities patients have are modifiable. So, how do we facilitate behavior change? How do we make our patients want to be more active? EIM has a certification both in lifestyle medicine and behavioral health that PTAs are
That's
able to sit in
really
as
helpful
well.
information. I know that there's oftentimes a lot of PTAs that I work with or students who are interested in working in a facility that might offer some of these different types of treatments, but sometimes struggle to find continuing education on it. So it's great that we have had the chance to touch base on that a little bit, especially pelvic health. I think that this is super important because we might not be able to treat it, like you said, in the realm or the scope of what a PT might be able to, and we might not be able to hold the same certifications. But I better know what's going on with the patient, because if I suspect that there's some pelvic health things going on, we need to let the PT know immediately. So it's still immediately. So it's still PTA programs, anyways.
Yeah, and EIM, I as an educator, I'm sure that you teach your students that they're lifelong learners. Well, even those in academia, I mean, EIM just launched it's a certification in faculty excellence. So making sure that we're approaching our students in the best manner. Evidence in Motion has things on that. They have courses on business management because PTAs may own or manage a clinic. So there's coursework, even not clinical, that they would have to continue that lifelong
all these are things
process.
That I hear when I own a business as a PTA. And so, there's a place to get all of there's a place to get peeled for more information from Evidence in Motion because they just keep coming out with new things.
Yeah. And with Evidence in Motion, they're updating courses every 2 years. And so that if you take a course, it's always going to be the most recent information. There's a lot of fantastic faculty members for EIM, not only in the PTA certification, but you're going to learn from some of those leaders and researchers in those studies that we publish.
Really cool. That's great news. The things that are new to the show that we have not talked about yet. What are a couple of things that you hope that every PTA or PT who's listening takes away from this specific episode?
Sure. I think the biggest takeaway is understanding that we can't provide complacent care. We always have to be hungry for that new information because patients change and the healthcare landscape continues to change. So if as a PT, you're seeing a PTA providing that complacent care, approach it from a mentoring standpoint and offer to help strengthen any weaknesses. Burnout is such a big topic, I think all over, but I know especially in the physical therapy field, and sometimes taking a course might renew and facilitate a reduction in burnout. That's what I do. If I start getting overwhelmed, I'm looking for a course to take. I love that knowledge. And just, again, stay hungry. There's lots of information out there.
I love it. Stay hungry.
Stay hungry.
In the way that we speak to each other, really for our patients as well. This is big. If we input fear. Sarah, where can people learn more about Evidence in Motion, the certifications that you're talking about, and how can they get a hold of either someone there or you?
Sure. So if you go online, it's evidenceinmotion.com, and that'll take you to our homepage. You can look on the side, and there's areas for just continuing education classes if you just want to dip your toe in the water. But if you're ready to just dive in, cannonball into the deep end, they can click on certifications too. And Evidence in Motion's website is very user-friendly. You can actually choose what courses are available to you as a PTA. So you can choose that profession. And when we click on that, there's about 12 programs PTAs can take as well. There is a chat function on that website, but you can also, if you have specific questions for PTAs, you can email me. It's sowens@eimpt.com.
I'm happy that we were able to share that today. I hope that everybody is inspired to just kind of consider what continuing education looks like, what that looks like for your patient, what that looks like for your facility and for your team, because when we elevate ourselves, it helps elevate those around us as well. So I appreciate you taking the time to talk to us today. Yes, of course.
Thank you so much for having me.
We'll talk soon.
Yep.
Thanks for listening to PTA Plus, the podcast for PTAs by PTAs. Subscribe, follow us on social, and share the show. Elevate yourself. This show is for educational purposes only. No clinical decision-making should be made from its content. See you next time.